Welcome back to Mountain Connections. The pandemic has made us put our health as one of our top priorities. Recently, I had an interesting conversation all about generic prescriptions. What do you need to know? Is it different? How much money can you save? Really is something to consider right now. So let's take a look.
FDA-approved generic medicines are central to American healthcare, filling 9 out of 10 prescriptions dispensed in the United States. Joining us to discuss the central role of generic drugs is the president and CEO of the Association for Accessible Medicines, Dan Leonard. Dan, thanks for being here today.
Thank you. Thanks for having me.
What are generic and biosimilar drugs, and what is the difference between them and their brand name competitors?
So the easiest way to think about this is that there's no therapeutic difference between a brand name drug and its generic counterparts. The biggest difference is the cost. So generic drugs are safe, effective. They undergo the same rigorous FDA inspection and approval process as the brand name drugs do. They have the same clinical benefit to the patient as the brand name drugs do, but they're simply as a feature of competition, the price is significantly lower. So FDA's own data shows that when 6 or more generic products come into a market to compete with the brand, that the price will go down 95%. So dramatic price reductions. It's really the only component of healthcare, one of the few components in our entire economy where the price goes down over time. And that's because of competition.
You just released a new report detailing the economic benefit of generic and biosimilar drugs to American patients. What are the findings?
So the critical findings in our new report is, as you cited, that 9 out of 10 prescriptions fulfilled in this country are for generics, but we're only 18% of the cost. 18% of the spend is on generics, which means that 10% of the brand name drugs are driving 82% of the spending. So that's significant savings to the tune of $338 billion in savings last year alone, $110 billion in Medicare, $53 billion saved in Medicaid. So these are some big numbers, and it's really, again, as I said, the only part of the healthcare system where prices go down over time.
Well, those are big numbers for the healthcare system, but what does that mean for people visiting the pharmacy?
So, yeah, I threw some big numbers at you, but what may have more impact is what it means to the individual patient. So when you go to the pharmacy counter and you have a copay, this is what you're paying out of your own pocket. For a brand name drug, the average copay is $55. The average copay for generic is $7. So again, significant savings to the patient for generics.
Really is significant. And before we let you go, the savings in the category of drugs for treating cancer definitely stands out. Can you share more about that?
So I mentioned biosimilars. This is a new category where biosimilars are essentially generic competitors for high-cost biologic medicines, often administered in a hospital or a physician's office. Oncology uses a lot of biologic medicines. So in just the first couple of years, we've seen the growth spend in oncology cut almost in half when new biosimilars come in to the market. So biosimilars saved $7 billion last year, but are anticipated to save $133 billion by 2025, when a number of very high cost cancer drugs and immunotherapies get competition from biosimilars. We're going to see significant savings up to $133 billion by 2025.
And where can we get more information?
So the new report that I've just cited and information on this topic is all available on our website, accessiblemeds.org.
Perfect. Well, thank you so much, Dan Leonard, for joining us today. Really appreciate this information about generic and biosimilar drugs and how they can save a significant amount of money. Thanks for your time.
Thank you. Thanks so much.